Hello and welcome. Today, we'll be discussing a serious eye condition known as traumatic glaucoma. This is a type of glaucoma that develops as a result of an eye injury, and it's crucial to understand its causes, symptoms, and treatment options to preserve your vision. Traumatic glaucoma arises after an eye injury, whether it's blunt force trauma, like getting hit in the eye with a ball, or penetrating trauma, such as a sharp object piercing the eye. Specific causes include angle recession, where the structures that drain fluid from the eye are damaged, lens dislocation, which can block the drainage pathways, bleeding inside the eye, known as hyphema inflammation, which can also obstruct fluid outflow, and, less commonly, retained intraocular foreign bodies. The pathophysiology of traumatic glaucoma is complex. Following trauma, several mechanisms can lead to increased intraocular pressure, or IOP, the hallmark of glaucoma. Angle recession disrupts the normal drainage pathways, making it harder for fluid to leave the eye. Bleeding and inflammation can further clog these pathways. In some cases, the lens can shift out of position, physically blocking the drainage angle. Over time, sustained high IOP damages the optic nerve, leading to irreversible vision loss. The speed at which this damage occurs can vary depending on the severity of the initial injury and the individual's response to it. While precise epidemiological data is limited, traumatic glaucoma accounts for a significant percentage of secondary glaucoma cases. Its prevalence is linked to the incidence of eye injuries, which are more common in certain populations, such as young males, individuals involved in contact sports or manual labor, and in regions with higher rates of accidental injuries. It is important to note that anyone who experiences a significant eye injury is at risk. The signs and symptoms of traumatic glaucoma can vary. Some people may experience blurry vision, eye pain, halos around lights, or redness in the eye. However, in many cases, the initial symptoms might be subtle and easily overlooked, especially if the eye is already irritated from the original injury. It's essential to be aware that glaucoma can develop weeks, months, or even years after the initial trauma, making regular eye exams crucial. Sudden vision changes, even long after the injury, should prompt immediate medical attention. Diagnosing traumatic glaucoma involves a comprehensive eye examination. This includes measuring intraocular pressure with tonometry, examining the drainage angle with gonioscopy, assessing the optic nerve for damage through dilated eye exams and imaging techniques like optical coherence tomography or OCT, and evaluating the visual field to detect any areas of vision loss. A detailed history of any previous eye injuries is crucial for accurate diagnosis. Traumatic glaucoma can be broadly classified based on the time of onset after the injury. Acute glaucoma develops soon after the trauma, while chronic glaucoma develops months or years later. Angle recession glaucoma is a specific type caused by damage to the drainage angle. Neovascular glaucoma can occur if the injury leads to abnormal blood vessel growth in the eye, blocking drainage. The specific type influences the treatment strategy. Treatment for traumatic glaucoma aims to lower intraocular pressure and prevent further optic nerve damage. This often involves a combination of medications, such as eye drops that reduce fluid production or increase fluid outflow. In some cases, laser procedures, like selective laser trabeculoplasty (SLT), or traditional glaucoma surgery, such as trabeculectomy or glaucoma drainage device implantation, may be necessary to create new drainage pathways. Managing inflammation and addressing any underlying causes, like lens dislocation or bleeding, are also important aspects of treatment. Preventing traumatic glaucoma starts with preventing eye injuries. Wear appropriate eye protection during activities that pose a risk, such as sports, construction work, or any tasks involving potential flying debris. Ensure a safe home environment, free from hazards that could cause falls or other injuries. Prompt medical attention after any eye injury is essential for managing inflammation and monitoring for the development of glaucoma. The prognosis for traumatic glaucoma varies depending on the severity of the initial injury, the time of diagnosis, and the individual's response to treatment. Early detection and treatment are crucial for preserving vision. While some individuals may experience significant vision loss despite treatment, others can maintain good vision with ongoing management. Recent research focuses on developing more effective medications and surgical techniques for treating glaucoma, as well as exploring neuroprotective strategies to protect the optic nerve from further damage. Regular follow-up with an ophthalmologist is essential for monitoring the condition and adjusting treatment as needed.